We're going to learn more about a service at Mercy Health St. Rita's. It's pediatric therapy and what they do and how it's so important for area kids. Joining me today, we have two pediatric therapists from Mercy Health St. Rita's. We have Allison Bucher and Carissa Molenkamp. And thank you guys for joining us today.
Hi, thank you for having us. Yeah.
Okay, so, kids are heading back to school and they're starting to do things. So are there different things and stages that we should be looking at and watching kids to know if things are all right? I mean, and get us on track with kind of like what you guys do and how you help kids.
Yeah, so I'll go ahead and answer first. So for OT skills, as we talk about just going into school, by the time that kids are ready to go into school, start kindergarten, they should be able to color neatly in the lines. They should be using a grasp on their pencil that looks similar to what an adult would use. They should be able to draw and cut simple shapes, and then they should be independent with all those self-care skills except for tying their shoes. That comes at around age 7. So if your child's struggling getting themselves ready or they're having any issues with that, especially if they attended preschool and they had a preschool provider point it out, that's a good time to get them into therapy. And then other important stages are that birth to 3 range. I know that's not related to school, but that's the early intervention window. That's when the child has the highest capacity to learn new skills. So if you're noticing any issues from birth to 3 with how they're using their hands, tracking, playing with peers, that's a really critical stage too.
I mean, most parents hate to think, oh, my child's a little bit behind or they're not doing that and they're supposed to. But I think the silver lining is that people like you are there and can help out. And I assume kids can catch up and you wouldn't know when they get older, right?
The total treatment time, if you think a child starting at like 6 months of age versus a child starting at 6 years of age, they've already learned maybe some inefficient motor patterns or ways to compensate for that deficit. It's going to be harder to break negative habits, and their therapy is going to be longer than if they started earlier.
Yeah, so it sounds like parents should be well aware that a therapy would help out. So, I mean, is this something that a doctor has to catch or a teacher or the parent? And I mean, does someone have to go somewhere special to be able to get help from folks like you guys?
So anyone really can catch this, so to say. A teacher, a parent, a colleague, friend, someone may bring it to light in the parent's eyes. After all, the parents are around the kiddo most of the time. So a lot of times we see the parents may not even be aware, especially if their kiddo is unintelligible or hard to understand. Coming from a speech therapy perspective, parents may understand them because they're around them all the time, but other family members or neighbors might have a more difficult time. So if parents are made aware that maybe there is something that should be further looked into, they will need to get a referral from their primary care provider. And then at that point, they can come see us for an evaluation to determine if treatment might be appropriate.
Are there other areas? I mean, do you guys work in conjunction with others to make sure that things get caught and kids get the therapy that they kind of need?
Yeah, one thing I really love about our pediatric team specifically is that we all work very closely together. We're a very tight-knit group here, and we often we can't refer like doctors can refer, but we'll catch it in the evaluation. Like speech might catch and be like, oh, their motor skills aren't really looking on target. They might benefit from an OT or PT evaluation, and vice versa. A kid comes in for PT and that physical therapist would say, oh, your speech sounds a little behind to me. Maybe you would want to get a speech evaluation.
Mm-hmm. And that being said, also, if your kiddo is receiving in-school services in addition to outpatient private services, we're able to kind of sign a communication form that allows us to communicate back and forth with that teacher. And then that way we're able to make therapy as most effective to all environments as possible.
Wow, that sounds great. Another great exciting thing, I assume for you guys, the pediatric therapy has kind of been able to expand at St. Rita's, right?
Yeah, so we moved into this new space back in January, and because of this new space, we're able to treat more children. We have more room, and also more therapists have been added onto the team, so we're able to see our families. You can kind of expect one-on-one treatment, including a home education or homework program to continue working on the skills that we've done here at home.
So we have a big therapy gym right in the middle of all of our treatment rooms, which is nice. We have a swing hookup in there, and we set up obstacle courses, so nice big space. We have a smaller therapy gym. We have a sensory room that also has a swing hookup and some other sensory toys. We have a lot of individual smaller treatment rooms, and then we have a feeding room where we can work on those utensil skills, picky eating, or more specific like swallowing.
Absolutely. And because we have such diverse spaces, we can kind of cater to each kiddo what setting might be appropriate for them.
Yeah,
Absolutely.
that's pretty exciting. All right, awesome stuff to learn more about pediatric therapy and Mercy Health St. Rita's. Thank you both for joining us today.
Thank you.
Thank you.
All right, don't go away. Noon Edition continues in a moment.